Good afternoon. It is November 2023. I am Dr. John Brosey, the founder, owner of Associated Clinical Psychology. By trade, I'm a clinical psychologist. Some things I'm proud of. In 2020, the Minnesota Gerontologist of the Year, and also in 2020, Lifetime Achievement Award from the Minnesota Psychological Association. Let me just tell you a little bit about the Associated Clinical Psychology. I started it in December of 1980, so December 10th is the first day of the 44th year. That's a long time. I'm still a full-time clinician, and many people that know us from the geriatric world don't know that we have 7 outpatient clinics. We have many doctorate level psychologists and licensed marriage and family and licensed professional counselors, licensed independent clinical social workers, and 32 prescribers, MDs, physician associates, psychiatric nurse practitioners. We also have a state certified DBT program, embed therapists in schools. We have an outpatient community-based program, which means embedding therapists in people's homes. And this is predominantly for family therapy, kids that perhaps are challenging or families that don't have easy access to get into a clinic, we go to them. We also support 2 immigrant-owned companies that provide psychological services only to immigrants. We provide the clinical and administrative oversight. The other thing I think that's unique about ACP is I'm a full-time clinician at this stage, as well as having a title of owner and CEO. But we have many clinicians and many administrative staff that have been here over 30 years. At the present time, we have about 350 employees, with about 300 of them being licensed mental health providers. So in watching this video, it's designed predominantly for administrators of assisted living, memory care, skilled nursing facilities, DONs, and social workers to better know about ACP. Because some people, this might be their first year on the job and not know. So why ACP when you think about geriatric services? We have 50 providers, therapists, and prescribers that go into nursing homes and assisted living every day. And I might add that we went into homes, most of us, every day during the pandemic. We also donated many computers to nursing homes that were short on technology during the pandemic. I first started going into nursing homes in 1980. There was no literature in how to provide services in nursing homes, but I had run group homes before for adolescents. So I had a very good understanding about how to manipulate environments to improve clinical outcomes for people, in this case older adults, but also how to improve job satisfaction for staff who are taking care of a customer base, i.e. nursing home residents who don't want to be there. And many of them, of the residents, are professional non-compliers. And anybody watching this video knows we have a responsibility to overcome their resistance, which isn't always easy. And this is where having a mental health provider that knows clinical things, but also knows how to use an environment to impact people is important. I personally train my staff to look at any issue that might come up in a facility through a clinical lens, through a regulatory lens, and a risk management. And many of our recommendations are designed to help improve clinical outcomes, make sure you as a facility are adhering to regulatory compliance, and risk management in case you'd be sued, which is on a huge uptick across the country. Other things that you may not know about ACP is that we make about 300 referrals per year to nursing homes. You might say, well, we never get one from ACP. It's because the hospital calls me or others on our leadership team and says, we've got this resident in this part of town who's doing A, B, or C. Where would you recommend? And I often will give them 3 facility names. But when the person's admitted, in your records, it's going to say admitted for Methodist Hospital, and my name is not attached to it. But we do make a lot of referrals. At least once a year, I'm involved in training health department surveyors, ombudsman, and others in the government that are involved with the care of older adults or statutory regulatory adherence. I'm on committees with every health plan, Blue Cross, Medica, Health Partners, and UCare, and how to improve the integration of medical and behavioral health services for older adults. We also are involved in training people in Minnesota and all around the country in the behavioral health needs of older adults. In the 7-county area here in the metro, we're in every nursing home but one. And we're also in many nursing homes, I think all of them up in the St. Cloud area, out towards Wilmer, down towards Lake City, over to the river, St. Croix River. We're under contract with all the managed care companies. That's important in the network so it minimizes costs to your residents for behavioral health services. I and others on our team have developed many memory care units around the country. I developed the dementia training program that was a joint venture between Alzheimer's Association, Leading Age, and myself. It's not active now, but I'm very seriously thinking about starting the dementia certification program under the label of Associated Clinic of Psychology. We are considered the provider of choice in the state of Minnesota. In our outpatient clinics, we have certificates from all the health plans on quality and on excellence in care delivery. And that's important also because the rules of providing mental health services in nursing homes from the health plans is different than providing mental health services in a clinic setting like where I am today. We are happy to be considered an expert. Last night in this very office, I was on the phone with a nursing home DON. If I mentioned the home, you would know who it is, that received a tag around an issue. That happens frequently. Last week, I was in this very office talking to the health department as a subject matter expert. And I say that not to pat me on the shoulder, but I would like to say that it represents that we aren't just mental health providers coming in and doing counseling with your residents. We want to help reduce worker comp claims. We want to help you improve your staff satisfaction, reduce turnover, reduce complaints to OHFC, and improve the customer, your residents' experience in your building. We have a long history, 43 years as of 2023, in helping facilities do that. We look forward to continuing to help you, and thank you for your partnership. Thank you for allowing us in your building. We know that you could partner with other people. We appreciate that you've chosen the Associated Clinic of Psychology.